You're watching WKBN 27 First News, where your news comes first in high definition.
All right, talking about flu season with Dr. Michael Sevilla from Salem Community Hospital tonight. When does it normally start, and what are you seeing this year?
Well, it starts a little bit. Usually starts a little bit later, but there's been some reports down south, down in Texas and Louisiana, that they're seeing high flu numbers already, and that usually means that it's going to only a matter of time before it hits us.
Wow, that's interesting. How quickly could it get here?
Well, people remember back in 2009 where the original bird flu came through, and over the course of 2 weeks in October, the entire valley was hit. And if people wait to get their flu shot, it's going to be too late. So that's why we're encouraging a lot of people, everybody to get their flu shots now.
So you're a proponent of the flu shot, and what I heard this year is that it actually matches the most common strain this year?
Yeah, what they do is they try to guess what the three most common strains are going to be, and what our numbers that we're seeing now is that they're doing a pretty good job of that. So that's why we're really pushing for people, especially in high-risk groups, the young, the elderly, a lot of people with chronic medical problems, to get their flu shots now.
All right, let's talk about some of the symptoms of flu, and it sounds simple, but these always come up year to year.
Yeah, exactly. I mean, the symptoms of it can be like any other upper respiratory infection, like fever and cough and shortness of breath, those type of things. So sometimes it can be a little bit difficult for people to guess, is this the flu or is not the flu? That's why we have people check with their doctors.
I'll get back to that in a minute, but you talked about some of the high-risk groups. Who would those be, and why is it important for them to take immediate action?
Yeah, people that people really look towards are especially infants 2 years old, especially under 6 months old, and also people with chronic medical problems, those above 65. Those are the people that we really kind of look towards to get immunized.
All right, right now I want you to play my doctor. If I'm sitting at home and I'm having some of these symptoms and I'm thinking, all right, it's just going to go away in 2 days, why is that wrong for me to think that?
Well, it's wrong because it can be contagious, and there are still, deaths from the flu. 36,000 people approximately die every year. About 200,000 people get hospitalized for it. So the longer you wait, the longer you can wait to get sick.
Very interesting. Dr. Michael Sevilla, thanks for being here tonight.
Thank you.
First News at 5 continues right after this.